back down to the field where Bill Steckes is standing by with more of our fine sponsors.
Yeah, and once again, it is Ortho Nebraska. Dr. Noah Porter is an orthopedic spine surgeon, and we're going to talk a little bit about spinal stress fractures. Doctor, what causes them?
So this is an interesting topic. There are essentially two kinds of these stress fractures. And interestingly, there are many times this fracture is present, and it's without any specific injury or any trauma, and there isn't a defined reason for the fracture to be present. But we know that there are very definitive risk factors for adolescents, usually sport-related. Those sports that are most common being football, gymnastics, and weightlifting. And contrary to most fractures where there's often one specific event where the fracture occurs, this is often due to a repetitive activity and some micro trauma to the bone that then ultimately fractures and causes pain.
What symptoms should parents look for?
The main symptoms that we see with these, particularly in the acute phase, is pain within the low back. Relatively uncommon for adolescents, but it's pain in the low back, particularly pain that persists over the course of several weeks. Occasionally there is pain that may be present in the hip or the hamstring area or the leg too.
When should someone see a specialist like you?
Yeah, I think that it's appropriate to see a specialist anytime there's concern about a new injury, new symptoms that are new and have not gotten better after being assessed by a coach, a trainer, or any concern on behalf of the parents. For this specific injury, the time that a specialist should be sought would be if symptoms are present for more than a 2-week period of time. That would make it relatively common for an injury like this to be present. Other worrisome things would be any sort of numbness or weakness in the legs, either one leg or both, or as I said before, any pain that's present around the hip area, the hamstrings, or in the leg.
And what are the treatment options?
So fortunately, contrary to many fractures that are related to athletics that may require surgery, this is one that essentially very rarely would require surgery. Treatment for this usually is a matter of rest and avoiding the activities that cause pain, which unfortunately may mean withdrawing from sport for a period of time until things heal. But it's a matter of changing activities, some medication, sometimes some brace wear, and then very important is some physical therapy.
Very impressive. I appreciate all of the knowledge. Outstanding, guys. Back to you.